All right, welcome to everyone who is joining us. I'm pretty sure we will have more people joining us as we move along, but I just wanted to go ahead and get started. First, I do want to start off by letting everyone know that we are recording, so please plan accordingly. But I want to welcome everyone. Good morning. Thank you for joining us early this morning. Welcome to Expecting Health's Casual Conversations, Challenging Topics, Navigating the Formula Shortage Crisis webinar. So my name is Dr. Ebony Drummond, and I will be moderating this webinar. And I want to start by giving a little background on Expecting Health. Born from Genetic Alliance, Expecting Health works collectively with organizations, healthcare professionals, people, and communities to provide the right information at the right time, from planning a pregnancy to early infant care. We know that even with so much information available, it can be hard for people to find the right answers for themselves and their families, which is why at Expecting Health, we believe that new and expecting families, regardless of makeup, income, and background, should and deserve to expect care and health. We simply don't think it needs to be this hard. Some of our core programs that we use to provide this information include Baby's First Test, Navigate Newborn Screening, and the National Genetics Education and Family Support Center. So that's just a little background on our organization and what we do. So before we jump in, just a few more webinar logistics. As I stated earlier, for those who might be coming in now, we are recording. And if you have any technical issues or questions that you want answered during the Q&A segment at the end of the webinar, you can either put them in the chat box, or you can just wait until the end of the webinar and just use the raise hand feature to be recognized. So jumping right in, and I probably, there we go. So first, I would like to introduce our panelists, and I'll introduce them again as it comes time for them to speak about their experiences. We have Caroline Nixon. She is a parent and an accountability guide, and she is coming to us from Caroline Nixon International LLC. And then we have Lisa M. Fisher, who is a nutrition services coordinator for the Tennessee Supplemental Nutrition Program for Women, Infant, and Children, otherwise known as WIC. And so we're so happy to have them with us today, and you all are in for a treat. They have such great stories and experiences that they're going to share with us. Okay, so I want to start off by talking about why this topic is important to Expecting Health in the first place. So typically our team, we meet regularly to discuss topics and issues and news that are currently affecting maternal, family, infant, and child health. And during one of our meetings, the formula shortage crisis was mentioned. So we immediately began talking about how chaotic things seemed, with everyone on the hunt to find formula. And we also talked about how there were stories of people traveling hours and hours to different towns and cities only to find that the shelves were still bare. We also talked about how homemade formula recipes were being posted on social media platforms and how this is a major concern for healthcare providers in terms of safety. All of this combined with the news articles that we were reading, and even as recent as the latest correspondence from the White House regarding the crisis, led us to want to host this webinar. So, what do we want to achieve from this webinar? It's really important for us to hear from people who are on the front lines of issues, because we know that their knowledge and perspective is truly valuable. For this crisis particularly, we wanted to make sure that families have access to helpful information and tips that they can use to navigate the crisis. And we wanted to do this by bringing together the perspectives of our panelists who have personal and professional experiences dealing with this crisis. So that way we can all learn from their experiences while also learning useful information as well. So how did we get here? To start it off, the American Academy of Pediatrics states that the formula shortage began during the pandemic and has mostly been caused by supply chain issues and the recall of several baby formula products because of bacteria contamination concerns. So these issues led to empty shelves, which then caused parents and caregivers to become increasingly concerned as to how they would be able to feed and nourish their newborns if they weren't able to find any formula. Even those who had the resources to travel miles and miles away from home to neighboring cities and towns still found empty shelves once they got there. As a result, many parents resorted to using familiar resources like social media, including the parent support groups that you can find on social media to find answers. And while these outlets and support groups are very helpful at times, and they do provide helpful information and tips, not all of the information regarding the shortage particularly, was correct or safe. But this is just a broad overview. What I've given you is just a broad overview of what families have experienced during this crisis. And so now I again want to introduce Caroline Nixon. She is going to give us a more personal perspective of the formula shortage as the parent of a 5-month-old, correct? Yes. As the parent of a 5-month-old. So good morning, Caroline.
Hey, thank you so much. This is Laura. She's with me today. This is 5-month-old. I wanted to kind of start out my story by saying that she came at 37 weeks and 4 days. I just went for a regular checkup and they said I needed to go straight to the hospital because I had gestational hypertension, and so that's high blood pressure. So the way to cure it, they said, was to have the baby. So she came early, and I mentioned that because her digestive system wasn't fully formed because she came early. And after consulting with numerous lactation consultants and that sort of thing, I wasn't able to breastfeed. And that was hard for me because I had always heard, breast is best and all of that. And then I got, used to this idea that fed is best. And then the formula shortage hit, and I was thinking, well, now I can't even feed her. And that was scary. So we went through, I called it like the formula experimentation dance, because we started out with Similac and Almentum, which are the Abbott company, and those are the ones that got recalled. And then we tried another one that she couldn't tolerate. And then we landed on Nutrimogen, which is good for colic, which she had, and acid reflux, which she has. And she can really only tolerate the ready to feed formula. So that's the one that's kind of pre-mixed liquid versus like a powder that you mix with water. So it's a very kind of specific formula that she can tolerate. And as you can see, like, she's gained weight, which has been amazing. But in the beginning, she wasn't gaining weight, and like that was a concern and that sort of thing. So I first heard of the shortage, I would say early March. And my husband's really into the news, sent me an article. And I think I took for granted that it would last as long as it had. So I just ordered a little more formula than I thought we would need. And then alarm bells started going off when I couldn't reorder formula towards like the end of the month. It wasn't available. It kept saying out of stock. And so then in April, I was able to order it again. And there's a cap on what you could order. So I just ordered the max amount. And then by May, it was really all over the news. And I was starting to kind of get fairly concerned at this point that I wouldn't be able to get her what she needed. So by the time May hit, I was able to ask like friends and family to actually order for me as well, max amount, as well as me ordering. And I found that, and I have this in the resources, but interestingly, like between 10 p.m. and midnight, that's when the formula would become available on Amazon. And it wasn't even available on the Infamil website, which is like the name of the brand company. But if you didn't check during the day, it wasn't there. But then at night, it would become available sometimes. And so I would have my friends and family also check for me too every day to see if they could see the link and if it was available to order. And then when the link became live to order, I would say you had about 24 hours to get it ordered before it went out of stock again. And then recently, I have been seeing, encouragingly, more formula in stores, and typically between like 10 a.m. and 12 p.m. So not first thing in the morning, but then I think like 10 a.m. it gets restocked, and then by lunchtime, it's usually out of stock again. And I'm hoping with supply chain and all that starts to improve, but that's just like another pattern I've noticed. And then, what's been challenging about the crisis is, first of all, the expense. So for 4 cases, there's 6 bottles within each case. She has about a bottle a day. It's $300. So you can imagine me trying to order all of this formula up front, not knowing I'm going to get it, and being like, well, I'm just going to have to put that expense forward. And my husband just graduated nursing school, just became a nurse. His first day was on Monday. And I'm an entrepreneur and I have my own business. So that's been stressful. But like we said, like Fed is best. And like this is what she needs. So I'm so grateful to have the formula for her and not have to be in this kind of scarcity space. And then and then I think just like emotionally too, it's been tough just because, like I told you, like Fed is best. Then I've been worried about like, am I even gonna be able to feed her? And I feel like my job as her mom is like to take care of her, and specifically, basic needs such as feeding. So it's also been mentally hard to figure out like how much formula to get, because you don't want to get too much, because then if you don't want to hoard the formula, and then that doesn't mean other people can get it. So that's been like another thing that's been challenging to kind of like navigate, to try and figure out the mental math of like, okay, how much do I really need? And then another helpful resource has been asking my pediatrician for samples. Sometimes they do have samples and they'll give them to you for free if they're available. So that's been like another helpful thing. But I was looking forward to hearing from Lisa on like what other resources there are and things that other parents can do that I just haven't thought of.
Wonderful. Well, thank you so much for sharing your story. Like I told you when I spoke to you earlier this week, your story really helped put everything into perspective. We've read these stories and we've seen things on social media, but to hear it come from, to be able to put a face with the story and hear all of the details, just things that we didn't probably even think about, you were able to bring that to our attention. So thank you so much for sharing your story.
Well, thank you for having me here, and Laura too.
Yes. She's so cute. And so I'm glad that when we spoke earlier, we talked about how it could be difficult for people who don't have the resources and information or community support that they might need to navigate the crisis. And that's why I wanted to bring in Lisa, because I feel that Lisa will be able to kind of close that gap for us. And so I want to welcome again, Lisa M. Fisher. Just a little background about Lisa. She has a Master of Science in Nutrition. She is a registered dietitian and nutritionist. She is a certified lactation counselor, and she is a nutrition services coordinator for the Tennessee WIC program. So welcome, Lisa.
Good morning, everybody. I'm so happy to be here and happy to share what information that I can to help benefit, families navigate through this issue and through this crisis. Yes, thank you.
Thank you. Well, first, just tell us a little bit about yourself and how long have you been working for the Tennessee WIC program?
Wow. I have kind of a crazy background here. So I started I started out working for WIC in 1994 once I completed my Master's of Science program from UT Knoxville. And I worked for WIC from about 1994 to 2001, all on the local level. I served in Fulton County, Georgia for a while, and then I moved to Dayton, Ohio, and I worked in Montgomery County. uh, that was roughly up to about 94 to 2001. Then I got pregnant and got married and had my baby, and I had a little bit of a commute. So to go from Cincinnati, Ohio to Dayton was too much. So my parents are educators and they said, hey, why don't you get your teacher certificate? So I said, yeah. So I became a secondary education teacher for career technical education. And I did that from 2002 until 2012. And so I decided then that I wanted to move to Tennessee, and I came to Tennessee. And again, I worked in a local WIC agency in Dixon, Tennessee for a while. And then I decided that I wanted to advance myself. And so I went and applied for a position for state breastfeeding coordinator. So I was state breastfeeding coordinator for the state of Tennessee from 2013 to 2016. And then my desire came back again to go back into the classroom. So I did that for a few years and said, I really enjoyed working for the state of Tennessee. So now I'm back since 2019 as a nutrition services coordinator. So with that position, I really love it because it encompasses all things nutrition education, which breastfeeding falls up under that, which is still my love, breastfeeding promotion and support. And also, I work with our MIS system, which is our system that allows us to conduct WIC services using a computer. So we're all electronic. We use the electronic benefit transfer, which is like the little EBT card that you can take and redeem for products that are allowed on our program. And I also update food packages, and very familiar with this formula shortage, and I'll get into that a little bit later. And, and so on my staff, I have 3 registered dietitians that work with me.
Nice.
Thank
Well, it
you.
seems like all of your background kind of helps you with your job. Like it all kind of comes together.
Yes.
The educator piece, the technical assistance piece, like all of that comes together.
Yes, I never thought in a million years that I would end up in education. When your parents are educators, you're like, no, I'm not going to be a teacher. But it's been all things education. Yeah.
So, Lisa, how did you first become aware of the formula shortage?
I tell you, media. Media was the first thing, even before we found out through, I'm up under the USDA. So the media started talking about it, and I shared it with my colleagues, like, have you heard about this? And we were like, yeah, but no one said anything, like, from our head office. And so finally, I would say maybe the second or third day in February, we just started hearing all types of things about Abbott. And Abbott is our contract formula for the state of Tennessee. So we became really worried, with our Similac product. So once we got the news from the USDA, then Abbott started putting out media. I forget what they call it, like a listserv. Like they started transmitting a lot of information, letting us know what was going on, what was happening with the Sturgis plant in Michigan, which was like the provider of Alimentum. That was one of the, yeah. So that hit really hard. So once we got all that information from them, we just started to make moves. We made moves here in Tennessee. And one of the things, and I'll lead into that part, what we decided to do, we first reached out to our partners from other states because we were really concerned because we had this Abbott contract. Like, what are we going to do? And so places like Minnesota, New Hampshire, that's kind of like our sister states because we have the same MIS system, which is our computer system that we use. And so they were like, hey, you're going to have to add different formulas to your approved product list. And we were just like, okay, so how do you do that? So we got all of the information that we needed. And I know if you look on the back of any product that you purchase from the grocery store, they have UPC code. So we had to obtain all UPC codes for all formulas that we could add to our substitution list. And I know I shared with Dr. Ebony our substitution list that we have for Tennessee, but every state should have that. And I know they have it in North Carolina because I actually reach out to the coordinator there. So she and I talk quite a bit. If I had known that in advance, I would have had it ready, Caroline. But yeah, we can always get that information for you. But yeah, so in speaking to North Carolina and other states, we just all started gathering all those UPCs for formulas that were considered substitutes for similar products. So like she mentioned, Alimentum, using Nutramigen, that is one of the substitutes. You know, there are so many products out there. We started learning that different stores have their own products, like Kroger. Kroger is really big here in Tennessee. Places like Walmart. Walmart has their own brand. And so on our substitution list, we just started just gathering all that data and putting it out there for our participants to know, like, hey, if you can't find Similac Advance, you know, Sensitive, you know, try Comfort. You know, there's a Comfort brand from Kroger, you know, Tippy Toes. I mean, we just all of it. So I was thinking this morning, I said, we probably have close to 100 substitutes now, and we're
Oh,
still adding
wow.
more. We're adding more as we go. And that's through, you know, through the WIC program, but that information can be obtained from those who are not on our program. Like if they want to know what other products can I use out there, we have it on our website.
That's amazing. That's a lot of work. Over 100. That's a lot of work to
Yes.
curate that list, I'm sure.
Yes, it takes, you know, like I said, there are like 4 or 5 dietitians that are on my staff, and we're all, you know, reaching out to the formula companies, obtaining rebates, because whatever we use that we add to our list, we want to make sure that we get some type of rebate. And that is one thing that's been very helpful with Abbott, and they've really worked with us on getting those rebates from using products like Infamil or other things like the Kroger brands, all of the brands that I've mentioned. Yeah.
Well, thank you for sharing that. Now, I know that since Abbott is one of your contracting, you said it was one of your contracting partners, or you have a contract with them.
Yes.
So I know that that served as a big challenge in trying to find the substitutions for the products that they created. But did you have any other challenges that you all faced once the crisis really became, you know, kind of the main deal that everyone recognizes it to be now?
Yes. So as I mentioned before, when it became on our end, the crisis, it was more so just reaching out to those partners and obtaining information about how to get these items added to our APL. In addition to that, we had to reach out to our medical providers, letting them know, you know, one thing that helps us with this and helped our families is that our medical providers have to complete a prescription. And on that prescription, we allowed them to write at least 3 common formulas that were in the same category. So like that would allow families, so if they couldn't find one, they could choose another one that was on that prescription. So we're still doing that to this day. And that's to help meet that challenge of not being able to find a formula that the physician has prescribed. So that's helped. And combat other challenges, we have a WIC shoppers app. And with that app, it allows our families to go in and see that substitution list. Now, it doesn't tell them exactly where to go. One thing that's been great about Abbott is that if you go onto their website, they have like an Abbott locator, and it allows you to see what stores have that product on hand. Now, it's not always up to date. And that's why I love when Caroline mentioned about the time to go shop and things like that. We always advise our participants and our families that give us a call to please contact the store before you go, because you know it may show up in the system as being there, like on the locator, but when you go, it's not there. So it's very important to call the store. And I think the vendors have been very helpful with helping our families navigate through trying to find substitutes. So that's one way that they've kind of met those challenges.
I love the idea of the prescription card from the doctors. I love that idea. Do you know if other states are doing that?
Well, yes, one thing about WIC, in order to, if you have a particular formula that you're in need of, and it's not like one of our contracted formulas, which we title WIC exempt formulas, the guidelines state that you have to have a qualifying condition. You have to, the provider has to provide that. They have to provide how much formula do you need in a day. They have to provide their signature, all this information in order for us to approve that particular formula at our local agency. And sometimes that can be a challenge too, because like I said before, they may put only one particular product. Participant can't find that product. And so now we say, hey, if they're choose similar, like again, alimentum. If there is another source that can compare to that, that's in that same category, Nutramigen would be another choice. And then we've done that for all of our formulas. And that's really helped. But again, the supply is the other issue. You go to the store and you don't see, none of them are available. So with that being said, we do constantly. I just had a request yesterday. I mean, constantly, every day we get requests for additional formulas to be added. And a lot of time it's the same formula, but it's different sizes. And it's really kind of complex when the formula companies, when they package things differently. They may have a ready to feed in a bottle, or they may sell it in these little individual packs. And so we have to put each of those APL or each of those UPCs in our APL. So it can't just be Enfamil AR. I mean, we have to have the certain package, the size and everything. So that has really been a challenge, like on our end, just trying to make sure that we can accommodate those, excuse me, those families with those different sizes of products, Yeah.
Mm-hmm.
Excuse me.
Oh, no, you're
Yeah.
fine. And what do you think we can all learn from this crisis to better support and prepare families in the future? So in future crisis situations.
Yeah, I definitely think trying to be prepared as possible, trying to understand, what, if you're intending on using formula, doing your research, what's out there, what's available, just in case you encounter any type of issues. We do support breastfeeding. That is one thing that we strongly try to encourage our families to do. We have had moms to go back and relaxate. I mean, we've had moms say, I'm going to stop breastfeeding. And then 2 months later, they're back at it because of all these issues that have come about. And just using your support system, talking over with your providers, letting them know what's out there, because I'm not even sure if the providers really know like the cost of some of these products, that are out there, and you might have to educate them. And I do know that a lot of the manufacturers are reaching out to the providers, letting them know like, hey, if your um, patient can't locate some of these formulas, they have been willing to ship cases to the provider and let the participant pick it up from there, or they may ship it to the the patient's home if they need to. So again, it's like educating providers on what the manufacturers will do. And they will go through the providers and avoid, like our local agencies, they will avoid that and just only work with the providers. So there are certain companies that are doing that. Um, yeah, that's that. I put something else I was thinking about, and this is something that we always try to educate our participants is, again, having like a feeding plan. Like just have something in mind of what you think you want to do. Like what happens if you come into this crisis where your baby can't latch? What do you think are going to be your next steps? And we offer in our WIC program, we have breastfeeding peer counselors, we have other support, we have our registered dietitians on staff. So we have a lot of people on staff that can provide the information and education to our participants and to our families in the communities. Sometimes just reaching out to your local health departments, and they'll be willing to help you. Yeah, it's just a lot. I think this pandemic and this crisis, it's opened a lot of eyes. I mean, people are just really, I think, going to really think and try to map out a plan and the best that they can to their abilities. Yeah.
I agree. It's definitely, I guess, revealed some spaces where there's like broken connections within like the healthcare system and different parts of it. So I agree with that. I think I love the fact that you were talking about, bringing that education to the providers because they may not be aware. And so parents could definitely, feel comfortable to bring that information to them and say, well, this is the actual cost of this. Is there something else that is this similar but may be less expensive? So I think that ties into the prescription card that you were talking about too, where they'll have all of those options if need be. So I really like that piece that you were that you hit on. That really struck a chord with me.
Mm-hmm. Yeah. Yeah.
Well,
yeah.
Oh, no, please
No,
go
I was
ahead.
gonna say, yeah, and I was just gonna add that, a lot of the information that we put out there are things that have come down from the USDA that they've filtered out to the state agencies, which is my agency, that we filter out to the local agencies. So this is not all my ideas. These are things that have filtered down and that we've shared across to other states. So yeah, that's all I want to say.
No. You've provided such great information. You really have. And I like that you all have so many, like you've thought about so many different resources from the list online to within the app. So I really like that you all are meeting people where they are.
Yes.
And I want to drive the point home that you mentioned that all of this information is not just for WIC participants, that anybody can access the website, which I will show you all the link a little bit later, but anyone can access the website and get access to all of this information and the tips that you all have put out there. So I think that that's really helpful because people might say, well, I'm not a WIC participant. So, and you're letting them know, even if you're not a WIC participant, all of this information is still readily available for you.
Right. And I would also add that even a lot of families don't realize that they're eligible for our program. We take families up to above 185% above the poverty level. So it's really important for families to go on their different state sites and see the eligibility requirements. You meet the income guidelines, you have a nutritional risk, and we and you have to be in the categories, of course. We have, I didn't talk about that, but we do have different categories that of people that we serve. We serve infants from birth to 1 year. We serve pregnant women. We serve women who have just had a baby and women who have had a baby and they're breastfeeding up to 1 year. And our children are on from age 2 to 5. So it's just very important for families to go out there and, check the website, see if they meet the eligibility requirements, at least for income first, and then reach out to the local agencies about making an appointment to see if they qualify with other risks. And I guarantee if they meet the income, they should qualify with the other risk, especially during this time. We have a lot of waivers in place. We've done a lot to try to really serve our families.
That is great information. Yes, you're right. People probably don't even realize that they're eligible and can be receiving that additional help during these difficult times, just not even with the formula crisis, but just with the pandemic in general. So thank you for bringing up that point.
You're welcome.
Well, I want to take some time to thank both of you for joining us this morning and providing your experiences and your stories and all of this great information from both of you. I mean, the times that you were checking on Amazon and the products weren't even available on the formula website, like these are things that I would not have even thought of. And just the list of great information that you gave, Lisa, I never would have thought of that either. So you all were perfect for this webinar. And I'm so glad that you were able to join us this morning. So I'm going to share my screen again so I can share some resources with everyone. Okay, so Lisa and Caroline did hit on some of these or all of these, but just to reiterate, you can talk to your pediatrician if you have questions. Like Caroline said, the pediatricians may have samples. And even Lisa said sometimes the manufacturers are shipping samples directly to the pediatrician offices. So talk with your pediatrician and see if they have samples or any information about where you can access formula or substitutes. Contact your local WIC office. Lisa just gave us great information about all of the services that WIC offices in states all across the country are providing. So definitely take advantage of those services if you can, and at least just reach out to them and get more information. And then you can also contact Abbott for more information on the Similac infant formula products. Other resources that are available. So through their healthychildren.org website, the American Academy of Pediatrics released an article that provides various tips that families can use to find formula. It's a very great article. I've read it a few times now, and so I would definitely suggest going to that website and viewing that article. And if anyone wants to email me, my email address will, I'll put it on the screen at the end, and I can send you these links specifically. Also, the American Academy of Pediatrics California, excuse me, just released a webinar that provides information on everything from finding formula, the proper use of cow's milk, breastfeeding, solid foods, and much, much more. If you are wanting to know the specific steps that the White House has taken and is taking, you can go to the White House website and read their information. And then the FDA also has on their website a list of actions that they've taken as well to navigate this crisis. All right, so now we have reached our Q&A segment. And so I think there was one in the chat, or Mariana, did you already answer that one?
I briefly did, but if Lisa has some additional insight, the question from the chat was related to have the formula companies provided a timeline of when they'll be back to full production or inventories in stores. So Lisa and Caroline, if either of you have input or communications that you've received to help answer that question, that'd be great.
I would like to add that information will have to come directly from the formula companies. They have not informed us. And pretty much what we obtain is kind of through the media. So it's been very quiet lately. We have not had any updates. Yeah.
My screen is over here having a mind of its own. Let me see. And if anyone had any other questions, you can feel free to use the raise hand feature and we can go ahead and recognize you so you can ask your question. Okay, I don't see any, but I have two just generic questions for you all. What does the next 3 to 6 months look like for you, or what do you envision happening in the next 3 to 6 months?
I'll go first. I have Laura on more solid foods, so I'm encouraged by that. So more solid she eats, the less formula she needs, which is great. And I've tried to stock up, like I said, so I don't have to be in the scarcity mindset. But what I learned from earlier this year was like, take this seriously, and it's probably not going to get better anytime soon just because of the supply chain, employee deficit, getting all the ingredients from other places. And then even like with Abbott, I read in the news, they supply 40% of formula for this country. And then even in as early as June of this year, so last month, they had a flood in their facility. So it just feels like prepare for the worst and expect the best is kind of how I think about it. I just don't think this can be easily fixed.
And when we were talking about, when Lisa mentioned, like, what can we do to prevent or at least help in future crisis situations, that was something that came to mind when you and I were speaking, Caroline, about how in the beginning it was just whispers. And so, sometimes when you're reading stuff on social media or you hear these whispers, you don't really take it seriously because you don't know. You might be like, okay, well, let me just get a little bit,
Yes,
just in case, but you're not thinking it's going to be like this. So that's good advice too. Lisa?
Well, from our standpoint, we'll continue to add formula substitutes as we receive them. The boots on the ground, our families, they're the ones that let us know what's out there. We can get information from the formula companies, but it's too late. I mean, our families are letting us know what's out there, and we'll just continue to add them to our product list. And hopefully, we're just hoping that this will end soon. It's really been just a mind-blowing experience. Yeah, so we'll just continue to add and continue to provide support as we continue to do what we do and answer questions and serve as a resource.
Great. Well, if no one else, I'm still looking. I don't see.
Dr. Ebony, I think
Oh,
there
yes.
are actually a few questions in the chat box. So
Oh, wonderful.
yeah, the first question is for Caroline. And it was that you mentioned earlier on the observation of kind of the patterns of availability and when you could order. So I'm just curious if you could share a little bit more about how you started to observe that, or, was it just kind of incidental that you figured that out, or how did you figure that out? And is there anything that can be shared with other families to help them look for those types of patterns in their communities?
Yeah, so I, much like Lisa was saying, I like kind of enlisted my friends and family to figure out those patterns, because I was checking during the day Amazon to see. And then my sister-in-law texted me that night at like 10:30 that it was live, meaning I could get it when, earlier the day I couldn't get it. So, and then it happened another time. So I realized, oh, okay, they kind of put it online later in the evening, like 10 p.m. to midnight. And then I've had friends and family, whenever they're out shopping for their babies or just shopping in general, I just have them go down the formula aisle and have them text me, do you see anything, even people in different states, you see formula, all this stuff. And so that's when I started to figure out there's a pattern. There's kind of the stocking pattern of, that 10 to 12 period, typically for the stores. So I would think it's probably pretty universal. Ooh. That's happening.
Yeah, and I would also add that we have vendor coordinators throughout the state. Each of our counties have, well, not counties, but our regions have a vendor coordinator, and they are in the stores every day, taking pictures. Like I said, our clients are taking pictures and sending them back to us. Even myself and some of our other state employees, when we're in the grocery stores, we go down the aisles just to see what's there. And one thing that I noticed is that a lot of stores have taken the formula off the shelves, and they'll put this little card in a little slot. And so it makes you think that the formula is not there, but they have it in another location. So you have to go to like the customer service and ask for the formula. which we don't like that practice because it makes families believe that there's no formula there. Some of our smaller chains were doing that. I don't know if you're familiar with like Food Lion, those small stores, they were doing that. So we just kind of question, like, you don't do that because you make our families think that you don't have it. So you may, we encourage families to check with the customer service to see if they're really truly out of the formula.
That's a good tip. Thank you. I
You're
never
welcome.
would have thought about that either. Okay. Mariana, was there another question?
There's one more, and it is, are there safety net organizations in your states that help supplement parents that utilize WIC but need additional assistance?
Okay. So Medicaid, but in Tennessee, it's called TennCare. They are available to service families for infants and children that have what we call those WIC qualifying conditions. So they may have malabsorption syndromes, just certain conditions that will enable them to have to be on some of those WIC exempt formulas or those therapeutic formulas, so to speak. So they are there to help provide assistance if they need additional formula. But WIC, once we meet our maximum allowed amount, we cannot offer more, unfortunately. Yeah.
Great questions, everyone. Thank you so much. Well, again, I want to thank you all so much for joining us. I want to thank our panelists, Caroline and Lisa, for joining us. And I'm going to go ahead and put up my information while I'm closing out the webinar, so anyone can take down any information that they need. But again, thank you for joining us early this morning from wherever you are. We really appreciate it. If you have any questions about anything, please feel free to email me and I can track down any information that you may need and get back to you. I can also send you all of the links that were on the resources page. And if you are interested in learning more information about the crisis or about any kind of current issue or news or topic that might be going on, you can feel free to visit our Baby's First Test or Expecting Health websites and join our newsletters. We put out newsletters every month, and so they have current information that we're tracking and articles that we're reading, and we definitely like to share those with our community. And other than that, thank you again, and this concludes our webinar. So everyone have a great rest of your day and a great rest of your week.
Thank you.
Thank
Bye.
you.